Thank you very much for another session with these Kodachromes. You know I enjoy doing it, and I enjoyed taking the pictures of most of these myself. Now we will go on to the slides themselves. The first Kodachrome is a calf, and you don't really see much, but if you look at his feet, you can see that he really has greatly overextended his all 4 feet. Well, this is dermatospraxis, and you could call it several things according to the type of collagen which is damaged. And look at his overextension of the feet because his ligaments are weak and they're being stretched because they are weak with this disease. Now, here's a calf that's just been born, and he's still got all the placental fluids all over the skin. When the barn man picked up the calf with the hoist in the postmortem room, all the skin tore, and the calf just tore apart, almost like a maniac tore him apart. It's so, the skin is damaged in so many places. Also, it's a newborn calf, remember, and look, he's got 5 or 6 or a dozen broken ribs here, and he's got a whole bunch of broken ribs here and fractures in all of these bones. That guy had over 100 fractures, several bones twice, all over the body. This is dermatospraxis. When you have collagen disease, the skin is affected, arteries are affected, bones can be affected. It's a collagen disease. And like Dr. Miner at school says, that's what holds the world together is collagen. It happens to be his research baby. And the calf had even broken bones in utero. These are healing fractures, which is quite interesting. And look at this regenerating bone in a rib from one of these calves. And this happened, I took the picture in Switzerland, but it's another calf with very weak bones, result of the collagen defect. A nice entity. This was a classic when I saw it, and it still is a classic. You're looking at a young calf. He's a little too old to have this white line here, so that's part of his disease because he has soft bones. Well, slightly soft. What you're really looking at, that I want you to see, is a subperiosteal hemorrhage, which is, as far as I'm concerned, pathognomonic for chronic lead poisoning, acute, subacute, or chronic. And it'll kill these animals quickly. Now, what did these calves eat, which makes it kind of interesting? Well, here's more hemorrhage, subperiosteal hemorrhage, which is pretty diagnostic. But this is what he ate. This is a little battery for a little motor scooter. And the young man, and this is in Australia, no less, the young man was making lead sinkers for fishing use out of these old lead plates. But he left the remnants of the battery right there where he was cooking it on an old acetylene torch machine. That was okay, but the calves love the taste of that salt, and when they lick a little bit of it, they don't need very much, and they will sure as heck be potentially susceptible to lead poisoning. Well, these were. A new entity for you, not that specific maybe, but this is very diagnostic and it's kind of specific. I'm going to tell you this is the tail of the calf, and here's its the perineum, of the cow, and here's its leg coming down here, lots of edema. Well, as you look at that, this is classical blackleg caused by Clostridium shoviae. So you're going to say, well, gee, that's not new, different, and unique. But what's new and different about it is that this is the 30 days postpartum blackleg of cattle, usually adult cattle, has nothing to do with like beef calves that are out on a pasture, and if you don't vaccinate them, a whole bunch of them die with it. This is adult cows that have calved within the last 30 days. Probably it's related to trauma of the hindquarters, maybe with a calf pulling machine, but really we don't know because they weren't all pulled by a machine. But this is 30 days postpartum blackleg, affecting the muscles of the perineum. Here's another one, the same thing. It's on brown paper. But you can see the gas, and when you talk about blackleg, you must consider the odor. And it's going to smell like rancid butter, sour milk, or something like that. And that's the odor of Clostridium shoveii in the tissues. You can also get that same odor with malignant edema, which is Clostridium septicum infection. But that's a fantastic lesion, but this is the idea to show it, is that it's 30 days or thereabouts postpartum. And that's why it's odd and unique. This is a fantastically new and different lesion for everybody, and I don't think anybody probably has seen it around, well, anywhere I know much. You're looking at a loop of intestine that has a blowout right here. And that blowout allowed ingesta to come out of the intestine. You have this fantastic peritonitis with all the fibrin and inflammation. Now, why does he have it? It is because the cow was calving. As the cow was calving, a loop of intestine was caught in the pelvic canal. And the farmer, not knowing what to do right or wrong, maybe, the calf might have had might have been stuck, had a little dystocia. And then the farmer puts a great big tractor on it or a truck, and he ties the cow's head to someplace in the barn, and he pulls the calf out. When he does that, he's pulling a slippery calf in the uterus out past all of this. If you can imagine a line and going like that up, it will finally blow out somewhere where the bubble of gas is, or the bubble of fluid, or ingesta. But that'll rupture into the peritoneal cavity, and the cow will die 3 or 4 days later, or next day, or something like that, with this. It usually wouldn't happen in natural birth, because when the cow is straining to have the calf, it'll hurt her so darn much, she'll stop calving. And there's not much stops calving, but I'm sure that would, because you don't see it in natural unassisted births. But maybe the veterinarian might do it, but I haven't seen one done by a veterinarian yet. So there's one. Here's another one. It's always just a loop of small intestine, and it's going to, if you look hard enough, he'll have a tear. Here's another piece of bowel, and it's coming down this way now, but it was blown out, again, by the assisted, we give it a name, dystocia-related gut blowout rupture. And here's another one. The gut is blown out right here, and you get all the peritonitis. Here's another one. There's the gut where it was blown out here, and this gut's going down here, and this gut's going down here, and that's all peritonitis. All because of this dystocia-associated lesion. Now, we all know what ulcers are. Ulcers are old hat. So I'm showing you a common ulcer in the cow's abomasum. And I'm showing you a needle going down into the blood vessel. When the cow got the ulcer, it eroded down and hit a major blood vessel. She'll bleed out from that vessel. Well, that's okay. I mean, if I had an ulcer in my armpit, it could possibly erode down to my brachial artery or something. I could bleed out from there. Well, but that's old hat. That's not too important. What you want to see is this one here. Do you see the lesion that killed this cow? You'd maybe imagine it, but this is a big blood clot, and this is his abomasum, and the thing that killed it is this little gadget right there. And I'm going to show another one up closer. Here it is right here, and this is a blood vessel. It did not have an ulcer first. This is an aneurysmal dilatation of a small arteriole in the wall of the abomasum. It is described in humans, in Japan, and we've seen it in cats here while at Cornell. And also this one is more common in the cow. But you must wash that bowel out. You have to wash out that abomasum in order to see it, because it's only as big as about half of my little fingernail. That's the total size, but it'll bleed out. This will also have a very characteristic odor, mostly in pigs, but when you smell blood that has been partially digested by hydrochloric acid, it has a very characteristic cider odor, fermented apple juice odor. That's kind of neat, but no big deal. Here's another one, did the same thing. And there's the aneurysmal dilatation. Now this is usually considered a malformation of the vessel, and when it ruptures, well, all you get is a hemorrhage and a ruptured vessel. This is not an acquired lesion per se to our knowledge. Fantastic lesion here. They're all fantastic lesions. It's what keeps me interested, I guess. You're looking at massive edema in a cow's lung. Now we need a reason why you would get massive edema in the lung. Bar 3 or bar 4 vaccine reactions, milk allergy, anaphylaxis, well, or edema. And that's what this is. This cow is a Holstein cow, I beg your pardon, Jersey or Guernsey most likely. You're going to hear about Jerseys and Guernseys versus Holsteins after a minute. This is massive edema of the lung because the cow is allergic to her own milk. And we had a cow, I guess she's dead now, for about 18 years at Cornell, that every time you tried to dry her off, she would start to go in, she would start to get pulmonary edema, breathe hard, and you know darn well she's going to die unless you treat the heck out of her. So they never dried the cow off for 18 years. You know, cows are supposed to be dried off once a year to let them recuperate and make milk for the baby, colostrum, and all that stuff. Anyhow, on this cow, Guernsey cow or Jersey, I've forgotten which, she came into milk production after her first milking, and when they tried to dry her off, she just died with massive pulmonary edema. It happens. Here's another one, the same thing. Now, many cows have abscesses in their liver. And of course, if you have a single abscess, it usually is found near the vena cava, because that's right in the hilus of the liver. And when the abscess is there, it'll get bigger and bigger and bigger, and it doesn't rupture into the liver. It doesn't usually rupture. I've never seen it rupture in the abdominal cavity. It will erode into the vena cava. If it's a large fluid abscess, it will rupture. When it ruptures, it'll put out a gallon or 2 gallons or whatever size it is of liquid pus into the vena cava. And you know the vena cava, posterior vena cava, goes forward into the right heart and right to the lung. So that's what you're looking at, the lung with massive edema because of a large abscess that ruptured. Of some interest, if you let this cow lie around for 6 to 12 hours and you cut the lung, you just slice it, it will have a very stinking odor. Why? It's obvious when you look at this. Every little blood vessel is filled with pus. And during the process of decomposition, it'll start making gas. So that's what you have here. Now, what if it's a small abscess? Well, we'll hit some of those. We'll talk about it. If it's a small abscess, it will shower the lung, the cow will cough once or twice, and it's got a little bit of abscess scattered, and then she'll go about her business, she'll be perfectly normal. However, what if the abscess back at the liver heals over and it gets the pocket gets full of blood and the pus is all gone forward, which wasn't much. Then it heals, and the next time it ruptures on an already sensitized lung, she can drop dead just as quick as the others from that pulmonary edema. This is a very difficult entity for you to recognize here. We have, in the old days, we had lots of cows that had bloat. When they had bloat, you're thinking they're on some highly fermented feed, or they didn't get enough roughage to stimulate the ruminal reflex for belching, or whatever. And you make the diagnosis because cow is monstrously bloated, and you'd do something for it. You'd tap her rumen and let the gas off and all this stuff past stomach tubes. But we see in Angus and Herefords and Jerseys and Guernseys, especially with bloat, we can see another entity, and that's this bone right here. It is called the wing of the orbitosphenoid. It's far too prominent. So when we saw those animals, we said, holy cow, that's a dwarf. And those are the dwarf bones, because all those dwarf calves, incidentally, they were dwarfs, Angus, Hereford, Guernseys, or Jerseys. And we would say, well, gee, they're bloaters and they're dwarfs, and here's the bone to prove it. Until this kind of guy comes along. He's got white hair and black hair, so he's probably a Holstein. But he's not a bloater. I beg your pardon. He's not a congenital he's not a genetic, he's not a dwarf. So it probably isn't really genetic. Well, it might be genetic, but it's not like those others, because we have never seen a Holstein conformational dwarf, where he's really short, but in good ratio of all of his bones. You only see that to my mind, you see the perfect calf that's 9 months old and he's about 2 foot high or 3 foot high or something like that. You only see that in Angus, the Herefords, Jerseys, and Guernseys. This is a Holstein with the bloat bones, because this guy is a chronic bloater. And the owner, if you ask him and you get a bloated calf in like that, you're going to ask him, well, is this guy bloated all of his? Oh yeah, every now and then he bloats, so we have to be careful with him. And these are the bloat bones. So if you have a bloat, a dwarf animal, most dwarfs are bloaters. You'll find this bone in there, and you can say, hey man, you've got a dwarf, don't breed your bull and cow anymore unless you want more dwarfs. Anyhow, that's the bloat bone. When you have bloat, the internal pressure inside the abdomen and the chest gets bigger and bigger because the guts are blowing up with gas, and right at the thoracic inlet from the inside, it will stop the blood coming back. So this is distal on that esophagus, and this is called the bloat line. So that helps you make the diagnosis of bloat. It helps. It's not 100%, because you can have cow that has still mobile blood. It hasn't clotted. These, the gas will, after death, if he bloats too quick, it'll push the blood out and you'll have a line too. So it's not 100%, but close. Here's a normal area of the skull in a calf. A new lesion that not many people have recognized, and this is a disease called TEME, thromboembolic meningoencephalitis. Everybody knows about that disease, called by Haemophilus somnus, or used to be Agni. I think they've changed the names. But what you see with thromboembolic meningoencephalitis are areas of hemorrhage, hemorrhage, probably a little bit here. And that's the brain lesion in meningoencephalitis. But what you just also see is areas of infection of the larynx or trachea. And look at this. Here's the epiglottis, here's the laryngeal cartilages, trachea, and here's the focal necrosis. That is probably the portal of entry for this thromboembolic meningoencephalitis. Another fantastic lesion, which bothers me a great deal. I went to Brazil, and these bones came from Brazil, and I picked up 4 of them while I was down there. I did autopsies about half a day, or I went to the farms, and then I showed Kodachromes the other half, just like I'm kind of doing here. But the guy said, hey, or I saw 2 of them laying around, and I said, gee, those are interesting. What are they? They gave them to me. But I picked up 4 of them from several different places. This is evidence of pica, P-I-C-A, where the animals have an abnormal craving for something to eat. The poor people moving from the south to the north, white or black, but commonly the black people who are poor, they did not have calcium, and they knew the drywall in houses, and the white people too, wasn't just blacks, would eat that stuff to keep their bones from getting soft when they got pregnant. And it was a major damage to buildings in the north because they don't have wallpaper in the south. It would all melt in the moisture, even Washington, I guess. But anyhow, these cows are eating this stuff because they have a mineral vitamin imbalance. But these are adult cow bones, and the other 2 are too. They always have this shape. They're about 6 inches long. They have the notches at both ends, and they're all found in the rumen of the cow. How can that be so? I don't have a clue. Where do they get these bones, and why do they stop at just 6 inches? I guess they swallow them when they get down that size. But what do the cows die from? If any of you know about the pathology in South Africa, Sir Arnold Tyler lost an arm or lost something in South Africa, and he worked on this disease. And he showed that these cows would absolutely go bonkers to chew old bones. But why'd they all die? They died from botulism, Clostridium botulinum. Why? Because the spores are protected inside these bones, and they stay there for months to years. And 20 years after the cow died, she can give another cow botulism if she chews these bones, damage the gums, and the organisms start growing that they got out of the spores. So it's really an interesting whole scenario there. Fabulous disease here. In mental asylums, I am told, they don't let the mental patients have free access to cold water fountains because they'll stand there and drink. Well, this calf does too. This calf is not mentally incompetent, but he doesn't know that if he drinks a lot of cold water, it will cause intestinal blushing or intestinal blanching, and he will absorb so much of that water that he will cause intravascular hemolysis. And that's what happened here. He'll get edema of the lungs, the tissues will turn yellow because he's broken down his red blood cells by drinking all that cold water. You can get it by just taking IV, water in, you'll break your cells down. That's how they do it when they drink cold water. And Roger Bannister, that physician in England, broke the 4-minute mile. Many of the runners will pee red after a big race. Some of it's myoglobin, but some of them is probably the cold water they drink, causing intestinal flushing, absorption of too much water, hemolyzing the red cells. And you get icteric, you get brown kidneys, yellow color, and wet lungs. A nice entity. We see it in the north because sometimes the water freezes and the calves don't have anything to drink, for maybe 2 days. And then all of a sudden they thaw out the pipes and the calves just stand and suck it. And man, a lot of them will get that. And he said, oh yeah, every year I see that. These are oak trees. They're live oak. So that's either England or someplace like that, or Australia, and this is Australia. So I go to Australia, and A lot of those trees are the trees they have in Australia. Gee, it's past my mind. But anyhow, these are the live oak trees. In here are all sheep. And what happens is they'll get massive nephrosis. This kidney should not have these little white streaks here, should not be this edematous, but this guy is dying from renal disease from eating live oak trees. And they're eating the acorns for the most part. In my opinion, I think many of them are eating moldy acorns, and it's a mycotoxin effect causing the nephrosis. But I know Pansiera, who wrote on acorn poisoning, doesn't quite believe that, but I don't know how to convince him otherwise. These calves are all going to die with renal disease because they're eating the moldy acorns underneath this tree line they call, gee, I forgot what that called too, arboretum. They call them arboretums. It's a field that separates the two, a border of trees that separates two fields. Well, it's raining as I took this picture over there, but all those calves are going to die with renal disease from eating the moldy acorns. A fantastic lesion you're going to see here. Normal lung and abnormal lung right next to it, the same lung. And there's no alveoli here. All these are kind of funny looking bronchioles. This is the normal lung over here. But this is what you're looking at in a calf. This is a fetal lung here. It's not aerated with air because he didn't breathe. He was aborted. And he was aborted because he's got this monstrous mass of what? I just showed it to you, bronchus. So this is called a hamartoma, a extra amount of normal tissue for the area. Some people have a tendency to call these fetal tumors, but it looks normal except the architecture is crazy. So you can take it as whatever you want. Most hamartomas are vascular, and they're so associated with the ovaries of humans. And they're vascular lumps. Just the vessels grow and grow. They look normal, but they make vessels. It's not a cellular thing. It's almost an organ overgrowth. Here it is in another calf. The normal fetal lung here, another hamartoma. Here's his heart. Also look at his liver. The liver is abnormal because this is interfering with his blood flow. So it's a nice entity. As to be differentiated from this. This is a calf's lung. It's thrown up into round lumps. But what's this? This is a torsion of a lung lobe. It twisted in utero, and it caused a lot of reaction in the tissue, necrosis, and a lot of fibrin and fluid in the chest cavity. And that reacted on this lung, especially on that side, to cause this fibrosis. And that's just a accident of being in utero, I guess. Maybe the old cow was laid on or twisted or something. I don't know. Many times people say, well, look, the calf has chronic pneumonia and he has no body fat. That chronic pneumonia caused starvation. That's pure baloney most of the time. You're looking here at a calf that's got a cranial ventral pneumonia, about half of his lung. You have to palpate it to make sure, but look at it here. It's all fibrin, necrotic debris, and all that jazz. And here's a calf that's just been born. This calf just been born, and he's got pneumonia too, maybe a couple days old. And this is weeks old. And look at this calf. He ain't got no body fat around that heart. You can see the vessels well, and he's starved because he starved in utero. The old lady might have had mycotic abortion, mycotic placentitis. It might have had twins and the other one dropped out earlier or something like that. But it has no body fat. Whereas this one that's been chronically ill for a long time, and you can see all this reaction, it's butterball. So don't tell me just because it's got pneumonia That's why it starved. It could, but don't say it easy. This is a new lesion. This is a rumen. And look at that reaction in this rumen. You're not sure what it is. All the milk is washed out. They're not supposed to have grass in there too much. He doesn't. But he's been drinking too much milk. The Germans call this ruminal drinkers, meaning that they're stupid little creatures, and because they're worried about not getting enough milk at any one time, they drink too much at one time. You're not supposed to ferment your milk in your rumen. It's supposed to be fermented with rennin and all in the abomasum. But this is the rumen, and look at the wall. It's been burnt by all the acid that's developing from the digestion of the milk in the rumen because they overdrank on milk or whatever they're eating. And that's ruminal drinkers, and it's usually milk drinkers. Another Australian picture. This is fertilizer down here. The guy I worked for, no, I beg your pardon, a fellow and I in Washington State, we worked together for a couple of years. He and his buddy wrote a paper on this, and this is fertilizer poisoning. It's a wicked disease because, again, it knocks out the renal tubules, and you're going to die with renal failure. Well, they also call it superphosphate, because down in Australia, they burned off lots and lots of the forests, and they don't have the regular minerals, so they have to put a lot of superphosphate fertilizer on these pastures. If you leave it in a pile like this, inside the pasture, the cows will eat it because they like salt. And if you don't know about these things, here's a cow in New York that died with fertilizer poisoning. Observe the medulla doesn't do much for you because it's essentially normal. But the cortex is finely granular, and it does not have the nice, clean, uniform striations because that's tubular nephrosis. Now here's the guy at the barn who's feeding these cows or calves, and he runs the farm. The guy who owns it has no legs. He lost them in the war, so it's a big farm. They milk 24 hours a day, about 50 miles north of us in Ithaca. And so I went and I asked him, well, who feeds the calves? All these calves that were dying. Well, I do. I said, what do you mean you do? All the time? He said, of course. I said, well, you can't. Don't you get a day off? Well, he says, of course I do. Then who feeds them when they're there? Or do you feed them? But how do you do that, if you don't work all the time? Anyhow, it came about that he doesn't work all the time. He has somebody to feed him. Well, who wants to feed a bunch of ballin', dumpy calves, 2 days a week? Well, not somebody who's wants to make a buck. So you get somebody who's not too keen on money, and he's probably not too keen on money because nobody wants to pay somebody like that much money. So who do you get? You get kids, or you get old drunks. And that's what he got. He got himself an old drunk. And he walks in this barn where all the milk replacer is, which is white powder, where all the fertilizer is, which is white powder, where all the insecticides are, which are mostly white powders. And when you're slightly sloshed, which white powder do you feed the calf? Well, he made a mistake, and he fed fertilizer from one of the white bags or brown bags to the calves. And that's the way the cookie crumbles. Mm-hmm. Now, what do you think this is? I'd ask somebody that here, but this is an incomplete subaortic stenotic ring coming from the other side in this cow. A very common anomaly in all animals. Here's another one, beautiful all the way across there. It's under the aorta, subaortic, incomplete subaortic stenotic ring. And if you push it a little bit, here's one in a sheep. How do you know that's a sheep? Because he's got black pigment here, or it's a sheep or goat, because they're the ones who have melanosis of the aorta more than all other species. You can see it in others, but mostly sheep and goats. Here's a dog with a complete subaortic stenotic ring. Now here's a cow with a complete subaortic stenotic ring. Remember I asked you what causes vegetative endocarditis? Heart anomalies first, or one of the top three. And then here he's got a subaortic stenotic ring, vegetative endocarditis here, also vegetative endocarditis here, a little bit here. But that's, and maybe a little fibroelastosis, but that doesn't worry me much anymore. And here it is up close, because I do take the whole silly lung, sometimes a whole cow, and then I go down and down and down until I get the close. Sometimes I don't. Vegetative endocarditis. The organism does not count, but why do we culture it? Because if you have several cows on that farm, or whatever, you might want to know, well, what is the antibiotic of choice? Well, the last cow had so-and-so, and the antibiotic that worked the best was so-and-so, then you can get one leg up on that infection in the cow. So that's a beautiful bacterial infection in this cow, secondary to the anomaly. The organism doesn't count. But if you go to Europe, my golly, if you culture something from that, that's the cause. Well, that's because they're a little bit, they're a little blessed with their background. You know, Virchow and Pasteur and the rest of them. You're looking at a cow's urinary bladder and all this emphysema. Now, that doesn't have, this cow does not have diabetes to get it like humans can. This cow does not have enterotoxemia like sheep get it because they produce the sugar. This cow was given sugar the night before. She's dead in the morning because milk fever, whatever, winter tetany, whatever she's got, they gave her calcium for. Here's a calf. This is his urinary bladder. This is the umbilical arteries that become the round ligament of the bladder as you get older. But this is all gas bubbles, and that would float on water. And that is because the calf was given glucose. And then it goes through, into the kidneys, into the bladder, absorbed through the mucosa, and enzymatically broken down to CO2 and whatever. Here it is again in another cow. A fabulous lesion, emphysema. Okay, this is really a nice kind of a great lesion in the calf. He's got a great big belly. And when you see a great big belly in a calf, what did it? Well, you're going to see it here. Here's what did it. You already saw the front half, and you saw that hamartoma, a little bit of the liver, and but this is the thing that's making this great big belly. What is that? There's a big discussion as the actual origin of these big cysts, but they're hepatic cysts. Most of them are in the capsule, and they're not related to the biliary tract, so they're not biliary cysts as far as I'm concerned. Here it is again. I've taken it out of the carcass, and here's the big cysts. It's attached to the liver, yes. Here's the omphallomesenteric. This is the gallbladder, and here's another cyst, or this is gallbladder, and that's another cyst. But these are hepatic capsular cysts. Don't go away mad, because here's two more calves. You almost never see these in adult animals. They're very common in calves, mostly aborted calves. Here's a couple cysts here. Here's a couple cysts here. Here's the omphallomesenteric. There's the omphallomesenteric. And here's a cyst here. And here's a big cyst, gallbladder here. And here's a gallbladder here. But here's the big cysts. And this is a very common lesion. Now, this is a brand new lesion that you probably might not have seen before, but an infarct is an area of dead tissue as a result of usually a sudden loss of blood supply for whatever reason. Now, in the liver, in the lung, you almost never get them because you have a dual blood supply. In the liver, you almost don't get too many infarcts either because you have hepatic artery and then the portal vein. And what you have here, these are areas of compromised liver. I guess I've called them incomplete infarcts or infarcts, because the blood supply is cut out, that make these areas of change, color change, fatty change in this liver, in the cow. And this is the reason. These are portal vein thrombi, because this is a disease of progress. When a cow gets a displaced abomasum, which is very common clinically, the clinicians go, listen, and they ping the belly and all that stuff, and then they tip the cow on her back, and they do manipulations and make the abomasum go back into position. And then they tack it down from the outside. But remember, while it was out of position, its blood supply was compromised sometimes in different ways. And it would get stagnation thrombi. When it gets a stagnation thrombi, and then you relieve the condition, you turn them and push the back into normal position. Those thrombi in the blood vessels, the portal veins, become free. They go to the liver and cause those so-called infarcts. And here they are in the rumen wall, and there's thrombi in here. Very neat. Now we talk about pulpy kidneys. This is the last 2 slides in this box. And this is a pulpy kidney in a cow, anotoxemia-like. But cows aren't supposed to get that, or they do, but not very often. And what you're looking at is this is all autolysis. But this is an infarct in one little lobule of the liver. And that occurred ante-mortem. But this is the rotten one. So if that died before, how come it isn't more rotten? Because it didn't get the sugar. And this is all rotten, and it got the sugar because they treated the cow with sugar solutions. And this acted as a substrate for these tubules. But this area was already infarcted, the blood supply was stopped, and the fluid, the glucose, couldn't get to that part, so it didn't rot. The next one is kind of a new one for most of you. You can see the cysts here. That's just of no significance, very common. But what you're looking at here are renal vein thrombi. That's the vein. In other words, it started in the kidney and is propagating out in some way. Nobody knows why or how. I don't know. But you usually see these in animals that have diarrhea or lots of electrolytes. Old people, this is common in old people, and you see it in children with diarrhea. Well, here's an old cow that was treated with lots of fluids because of milk fever or something like that. And you see it in baby pigs that have diarrhea. It's a kind of common lesion. Here's another cow, and look at that thrombus in the vein. It is not in an artery. And most of these are not associated with infarction. There's no infarcts in this kidney, anyplace else that you can see, nor in this one here. But sometimes you can have infarcts. There's an infarct here, it's dead tissue. But look at that's the vein, not the artery. Renal vein thrombosis. It's in mostly cows. Now this is called tension lipidosis, and this piece of connective tissue is pulling on that liver inside the cow's abdomen. As the cow is more prolonged gestation, birth, growing the baby, the liver will get a little bit heavier and fatty, and then it'll start being pulled on by the ligaments. And there's the first part that underwent some change. As that liver gets heavier, more vessels are compromised, and then more vessels are compromised, and that's probably essentially normal. So that's an old common, they used to call them tension infarcts or liver infarcts, but they're just a nothing much significant lesion. And that's what it looks like on section. Fatty, really fatty, less so, and probably normal. But we have something new and different with that now. This is multifocal vascular-related hepatic lipidosis. Nobody knows why, but when you pull all the tissue off, you will find that there are vessels coming out of the liver for every bit of connective tissue there. And it's vascular related. The others might be too, but there's too few to be sure. And just squish this liver and you get blood coming out of all those little vessels that were pulled off. Nobody knows what causes it. And if you look hard enough, you can find good big vessels coming from those holes. It might be the same thing. And here's the whole area that's goofed up, and there's a blood vessel. I believe it's a rerouting of the blood as it comes out of the liver. And here they are up close. You can see this blood vessel, big blood vessel, kind of cute. Overeating disease. I would ask our students, what is the parturient status of the cow? And I would expect them to tell me she had just calved, because this is a disease of just calving in cattle. Why? Because Bessie has been on the farm for 8 years. She's a good old cow, and she just gave you triplets or 2 beautiful heifer calves. You're happier than heck. And here, Bessie, you're so good to us, we're going to be good to you. Here's 2 dippers of grain instead of 1. The cow says thank you, and the bacteria and flora and fauna and rumen say thank you, thank you, thank you, thank you, and they multiply like heck and kill the cow with lactic acid indigestion from overeating. So don't be nice to your darn cows when they calve and come into full milk. But a lot of people do. Well, a cow can't vomit ad lib like you and I can. You and I can eat steak or 62 pounds of lobster for supper. And if you don't like it, you can lose it all. But the cow and the horse and that stuff can't do it. So you can't change their food indiscriminately. So you burn the living heck out of their rumen when you do. And here's a rumen burn. All of that tissue is DEAD, dead, because somebody fed it too much grain, or it got into a grain barrel by mistake, or somebody gave it bread dough instead of bread because they had a fire at the factory. All these things have happened. That's why I'm mentioning them. In addition, you'll get secondary mold to make the classic target lesions, but that's all toxic indigestion from overeating disease. And you'll get it in the abomasum, the true stomach. It'll burn that too. Just something you should be aware of. And this, when you see this is the omasum, and it's in the calf. Where are the foals? It all have foals like this. They're all burnt off here from overeating in the calf. We talked about how much time we talked about liver abscesses that rupture. Well, remember, here's a liver abscess that had ruptured before, and there's a scar on the surface. And this is a liver abscess. It has several other abscesses, but the one that goes into the vena cava is near the hilus. Now, this is why these cows die. It's a fantastic concept. Look at the blood all over the front of the stanchion. She's bleeding to death from her nose. Here's another cow that did bleed to death from her nose. She did bleed to death from the nose, and she's dead in a donut waiting for me. Here's another one that we hauled into post-mortem room, and she bled to death from her nose. When you look at her, here's the pulmonary artery, and here's the thrombus that was stuck there. Because what happens when you get a thrombus that develops in the vena cava, not abscess this time, thrombus, it might be septic, it might be infected, but not abscess. That thrombus breaks off in chunks. It goes forward into the vena cava, to the right heart. Through the right heart, I shouldn't have said to, nothing goes to the right heart. It goes through the right heart, and it stops in a pulmonary vessel. When it stops there, remember it's infected. The blood stops going down that vessel, but that stuff is infected. It starts growing and gets bigger. It gets bigger and bigger. The lung pushes against that, or it pushes against the lung fights it. It never, almost never, I don't think I've seen it, ruptures into the lung parenchyma. But it gets bigger and bigger and bigger, collapsing the lung as it goes, making it stronger on the outside. But when it gets to a bronchus, a hard cartilage bronchus, it says, hey, you move. The bronchus says, I'm not moving. And then the thrombus says, okay, I'll let the infection take over. The infection gets bigger. It erodes through the cartilage. And then when it gets so weak, it all of a sudden, remember, it's got a blood pressure pumping against it all the time, trying to go through, and it'll rupture, and you'll bleed to death by bleeding into this trachea right here, because this ruptured right through here, and it bled to death. Okay, one more great lesion. You don't see these commonly. Remember, you and I usually have sterile livers. If I whack you hard in the belly, I can break a piece of your liver into your abdominal cavity, and if you don't bleed to death, you live, that piece will dry up and go away. But if you do that to a cow, probably a horse or herbivores, they do not have sterile livers naturally. You do, dogs do, cats do, but not cows. And if it breaks off, it's septic. Well, this one had a blood supply stop, and the bugs in there grew like mad, and that's a Pasteurella infarct in the liver, all because he had a little bit of compromise to his circulation in the liver. Here's what it looks like on the outside in a big cow's liver, just a single Pasteurella abscess. Broken bones. Animals don't break their bones. They're tough. And if you get them with too many broken bones, then you can expect fractures as a result of soft bones. Just don't say it easily. And they have this osteodystrophic line, which is so diagnostic of mineral vitamin imbalances. Here they are. This is a number of episodes in this calf. They gave him calcium, took it away. Gave him too much, took it away. Or imbalanced him in some way. I never could find out what this did, what caused this, because a lot of them don't want to tell you. I don't know why. Usually I can get answers, but every now and then I can't from the owners. A cute little episode is that's a fractured rib, and this is lymphosarcoma. Every one of you probably would erroneously say this is a pathological fracture from lympho. That is incorrect. I'm going to tell you why. This is a fracture. You got irritation with lots of inflammatory cells that were susceptible. And when the virus came around, or the tumor, it set up housekeeping right near there. The lymphocytes became neoplastic. Here's subperiosteum, just like the lead poisoning. That's lymphosarcoma under the periosteum, like I showed you earlier, in both cats and cows and others. Here's the answer. Why? I believe with lympho, this is a kidney, and that's a white spotted kidney. It was. Now it's lymphosarcoma in that kidney. This is the lung of the same calf, and he's got lumps in there. There's no lumps here because he didn't have pneumonia there. But he does have lumps here because that's chronic enzootic pneumonia with turned on activated lymphocytes that became neoplastic. You've all heard of this before, but one good place to look in a calf that has white muscle disease, a vitamin E or selenium responsive disease, is in the muscle layer just underneath the surface of the calf's tongue, and right here. And that's what you're looking at, white muscle disease. You don't look too deep in the tongue, especially at the base, way in the back of the throat, because that's always full of fat, and it looks like white muscle, but it isn't. This is where you look for it. And if you look under the tip of the tongue on the underside, where the epithelium is not too thick, you can see the white muscle in the live calf sometimes. Mm-hmm. White disease. Here there's monstrous areas of, muscular dystrophy as a result of this nutritional deficiency, they say. At the cell level, it probably is a deficiency, but not necessarily in the feed. Because we usually see this disease because of a positive factor added to the feed by mycotoxins or microbiological products from something like moles or fungi and all that. But to me, many times they die with a little bit of lesion like up here, and they die with that. So how could this calf possibly live to get this much damage, or this one so much damage? I don't understand that. It's a really interesting thing. Here's some white muscle disease just underneath that tongue right there and there. So you can see it through the undersurface of the tongue if you look pretty hard, if you work at it. This is Braxy in an abomasum from a calf. Clostridium, you can get sometimes novii out of it, a lot of different Clostridia, just from overeating on some really contaminated feed with bacterial infection. And we've been talking about emphysema in the urinary bladder. Don't forget it in the rumen. And every time you see this in the rumen, that's gas bubbles, gas bubbles, gas bubbles. There's no infection here. This is the rumen. And this is, the animal was given Gatorade. And that's the glucose absorbed through the wall and then enzymatically broken down. And that's why you get this emphysema, emphysematosa rumen. Oh, this is a nice picture in case you don't recall your anatomy. This is the underside of a calf's liver. And here's his gallbladder down here, and here's a portal vein, and here's the umbilical mesenteric going down to the belly button. And here's all these vessels are coming from the guts. And here's the umbilical mesenteric comes up here, a nice thrombus here. But this is the ductus venosus going between the vena cava and the portal. And in utero, or just after utero, certainly after, quickly after birth, you can get this infection going up through here and going forward, and then you get embolic pneumonia. Otherwise, you might not be able to explain it unless you look at this part of the liver. Just an interesting aside. I didn't know what this one was. It's out of focus. You can't change it. I'm sorry. These are hemorrhages in the vagina. You'll see them in the eyeball. You'll see them on the tongue, in the mouth, a lot of places. Petechial hemorrhages, a little slightly larger. But you look here, look at these ecchymotic and suffusion hemorrhages on the rumen, on the reticulum, throughout the whole rumen, 4 stomachs, on the urinary bladder, in this calf. And if you keep looking, here they are in the bladder, and on the eye, and the conjunctiva, and in the ears, on the gallbladder, esophagus, kidneys. What is that? Well, it's septicemia, you'll say. But it's 10 months old. Oh, I beg your pardon. It's 8 to 10 weeks of age. These are calves with massive hemorrhages, and they're all dying with this massive hemorrhages. They don't have much of a fever, if any, and there's only one diagnosis. Here it is in the brain. You go to the farm, what are you feeding them? Oh, milk replacer and junk like that. Okay, nothing else? No way. We give them vitamins. And you go back the next week, and instead of talking to the wife, my wife and I talked to the farmer himself. And the first thing he said, well, when I asked him, what are you feeding them? He says, well, we start on a nitrofurazone, milk replacer, vitamin. What? Nitrofurazone? Yes. I said, but your wife didn't tell me that last week. Well, he lost 60 or something calves. Fed nitrofurazone. And then I called up a buddy of mine in Germany, and the guy had written a thesis on nitrofurazone in calves that get it for the first week of life and die at 8 to 10 weeks of life with massive hemorrhages all over the place. And that's what happened here. They die at 8 to 10 weeks of age with massive hemorrhage. Nitrofurazone toxicity. And it's a nice yellow powder. This doesn't do much for me. It's just multifocal embolic pneumonia. What's a good reason? If it was an umbilicus, it's not likely to go to the lung unless it went in the first few days while that sinus venosus was open between the portal and the vena cava. But you better be thinking of mastitis in a cow or calf. A cow, mastitis, mycotic mastitis will do it. Vegetative endocarditis could do it, and it'll look something like this. You have to rule all these out. there's something else I want to tell you. I got to think. Oh. Okay, now you're looking at a. Sorry, I lost my place. You're looking at a calf with a classical enzootic pneumonia. Cranial ventral lung. This lobe probably is not affected. The only way you know it is to palpate it anyhow. You can see it sometimes, but it's really best. It's really best for you to palpate it. Enzootic pneumonia, Pasteurella, is what we culture for most of them. We do FA on most of them, and we don't. All we get is Pasteurella. We do a lot of culture, sensitivity, and all that jazz, and we hardly ever get the virus. Everybody says PI3 and QRST and all those things, but come on, I really believe it's Pasteurella. Don't blame another virus, but some people try to. It's not a big deal, but here's another fantastic one. Most of you won't use this term here. If you look at this lung, it's an adult, or it's more adult cow, it's not a calf, and this is all resolving bronchopneumonia, because so many calves have pneumonia, most of them get better. Don't think that they all die. And if they don't, you must have some lungs that are getting better, but they get killed for some other reason. Maybe she got an eye infected or something like that, but she had enzootic pneumonia, and it'll take time, months, weeks and months to get better. And that's what she has here. There's no edema here, there's no congestion here to speak of, there's no hemorrhage here, there's no fibrin. So it's getting better, but you almost never hear people talk about it resolving bronchopneumonia. We do every day. The next that you're getting on is, if you look at this lung, I'm not sure what it is. So it's different because I'm not sure what it is. But if you palpate it in some of these locations and you're looking scattered all over the lung, remember the dorsal diaphragmatics are always emphysematous anyhow, almost in a cow. But if you look through it and you palpate some of these dark areas, they feel a little firmer than others. And it's different than any other lung almost. They're not focal and not cranial ventral. They're not really septic. This is BRSV pneumonia, bovine respiratory syncytial virus pneumonia. It's classic. Don't end. What many people do, and I'm sorry I can't show it to you well in these because he doesn't have any cranial ventral pneumonia, but many times these guys do have, even if they have BRSV, they have chronic bronchopneumonia in the cranial ventral lobes. That's because it's been there all the time. The BRSV virus doesn't wait until, okay, I know you've got I know you have enzootic pneumonia of calves. We'll wait till you finish it before we cause your infection. They don't do that. It'll get in there and affect the other part of the lung, and then you'll start getting a little alveolar lining cell proliferation, a few giant cells, and that's going to be our BRSV. It'll be all over the lung, scattered. And that's how you tell it apart. And here too, the same thing here. BRSV over the rest of the lung. It fits no other pneumonia in the calf, in the young cows. Here's a nice pneumonia. You haven't seen it very much, I realize. What you're looking at here is kind of big lymph nodes, but the lung doesn't do much for you. But if you keep looking, the lung, well, gee, and it's got some little white spots all over the place, and you're still not sure what it is, or yellow spots. And here you're getting closer. And you see this yellowish green color, and all these little things here. This is a classic. It's a diffuse lesion. It's never just cranial ventral. He might have enzootic pneumonia too. He might have a foreign body. He might have lungworms. But this disease is very specific. And look at the yellowish orange color of most of the airways. And it's even getting better here with edema. These cows go down in milk production. That's why you know. And they stand there and breathe pretty hard. And it almost only affects Jerseys and Guernseys. Almost never do you see it in Holsteins. And this is bovine asthma. And it's usually due to a mycoproduct associated with red clover, moldy red clover. So it's a nice new entity for you because I'm showing you new stuff. And you look in these things, they're going to be loaded with eosinophils more or less. And you'll get more in the mucosa too. It's a nice new entity that you should be aware of. From there, we're going to go to proliferative pneumonia. This is proliferative pneumonia. This is adult cows. It's not limited to Jerseys or Guernseys. It's a big lung. It's got lots of emphysema. So what? Don't be impressed with that, because sometimes, here's another one, BRSV. Beg your pardon. Atypical interstitial pneumonia is what you guys might call it. I call it proliferative. And I do that because the primary lesion is a proliferation of alveolar lining cells. You get a reaction in some of the stroma because that's where the reaction must come from. When you see a few cuffs in the brain because he's got brain disease, you don't say he's got a perivasculitis just because he's got lymphocytes coming out of those vessels. Well, anyhow, that's the same argument here. But this lung and the last lung, they weigh 40 or 50 or 60 pounds because they're big, wet, and heavy. Some with emphysema. Now this one has got the same disease and not a iota of edema. And it's proliferative pneumonia. You're going to strain your little butt picking this up because it's pretty heavy. Proliferative pneumonia. And this is proliferative pneumonia, but I believe this one is caused by moldy sweet potatoes because Perilla mint will do it, moldy sweet potatoes will do it, IP-menol, that's moldy sweet potatoes, paraquat, diquat will do it. Charlie Barron, who has something to do in the past with C.L. Davis Foundation, good man, he almost died with the reaction of proliferative pneumonia because of his therapy for his leukemia. And it was just like paraquat or diquat. Anyhow, it's a diffuse lung lesion, all the same stage and age, and you won't mistake it for much else. And here you're looking at it up close again. He's got a little emphysema, endedema, proliferative pneumonia. Here's a beautiful case, proliferative pneumonia. He's got it here too. But remember I told you earlier about the connective tissue in the diaphragmatic lobes, more common in cows and horses and pigs than it is in dogs and cats. That's essentially normal, but they have more emphysema because he's standing there and he gets more emphysema there. If he's sitting down, then it might be in the cranial ventral lobes more. Proliferation of alveolar lining cells. Rarely, now I've seen probably 300 or 400 natural cases of this disease. In that 300 or 400, I might have seen a dozen, maybe 2 dozen, with hyaline membranes. It's not very common. You can see it. It's a nice lesion when you do, but don't blame it on that. Alveolar lining cell proliferation. Now remember, here's a hyaline membrane, just to tell you at least I know what it looks like. And here's this is a little more chronic, and alveolar lining cell proliferation. You're supposed to have 1 cell or 2 cells with a nucleus here and a cytoplasm going around 1 alveolus. But when you burn that, when you burn that 1 cell, you stimulate type 2s and they make a glandular proliferation, adenomatosis-like lesion. Except that's in sheep, so you don't use that. Anyhow, proliferative pneumonia. I hate atypical interstitial pneumonia description for it because it's so typical and you know the reasons. You treat this with atropine, and nobody does because, and they say, oh, we treated that. If you treated it, and you better give them a whopping dose of atropine. That means a half a gram or a gram, and you probably couldn't buy it in Washington, D.C. Well, you couldn't buy it in Ithaca. Maybe Washington has a lot of problems and they need it. But because, if they're all smoking marijuana, diquat, paraquat, you might get the same reaction. The other thing about this is IP-menol is a moldy sweet potatoes, and the cows can eat the moldy sweet potatoes in Taiwan, for instance, where they have lots of moldy sweet potatoes, and they'll get this disease when I was over there. But that's IP-menol. Now, you feed it to a horse, and they also get the disease. You feed it to other animals, they'll get the disease. pigs. But they're not ruminants. Now remember, most of this type of lesion that develops in ruminants is because they inhale 80% of their eructated rumen gas. But so how do you explain it? Even crotalaria. Crotalaria in a cow, they can make it in the rumen, or they can change 3,4-methylindole or whatever you want, and they can inhale it, and they'll go to sleep. Because if you cannulate a sheep through the trachea and give him the same stuff, it won't hurt him. Why not? Because he can't inhale it, because he's got a tracheal tube. But the horse does it, and that's the same reason Charlie Barron got it. He got the drug and he eliminated it through his lungs, and going out did the same lesion as the cow's getting in. Think about it like that anyhow. Nice entity. The British in their original work with proliferative pneumonia, they talked about Hoos and Husk and all that stuff. They thought it was an allergy to lungworms, and I told them about that about 25 years ago, and maybe I'm persona non grata there. But anyhow, now you have another cause of proliferative pneumonia, and you're looking at it here, not those things themselves, but look at the ale and the ale. So these are ascard larvae in the bronchi of these cows. And when we first saw that, the parasitologist went ape because he saw them and he said, oh, it's a new lung disease. And the veterinarians all around the school said, oh, that's due to allergy to parasites. And I said, no, it isn't. Went to the farm, and all the heifers, I guess he lost 19 out of 21 that he had. Or he killed them anyhow because they're so bad. And we got these in all of them. And they're starting to get alveolar lining cell proliferation. And there's some eosinophils in there. But the reason for that is we can reproduce it now by feeding them pig manure without any ascarids in it. Why? Because that's where the nitrogen is coming from. Because you know Bill Monlux, he was one of the first ones to reproduce it in cattle using the higher oxides of nitrogen. NO3, NO5, NO7, stuff like that. But he made a mistake and called it adenomatosis of cattle. Well, that's a different disease than the adenomatosis of sheep, Yaxicta. So he shouldn't have done that. But it was nitrogen caused it that Monlux reproduced. Well, that's where these cows are getting their nitrogen, from the pig manure. And we've got lots of episodes of that all over the country. Now you're looking at a fantastic new disease which is difficult to explain. When 21 days after an outbreak of enzootic pneumonia in calves, you can commonly have 1 or 2 or a low percentage of those calves that were affected that develop an acute respiratory distress syndrome, and they die. And when you look at the lungs, they'll have cranial-ventral pneumonia that you can palpate, and maybe this will be firm and hard with emphysema or not in the rest of the lung. And this is called secondary proliferative pneumonia. It is secondary to the enzootic pneumonia that occurred 21 days prior. Dr. Fox, our clinician up there, says, well, that's exactly 21 days. I said, no, it isn't, Francis. And just more lungworms. It's a little bit screwed up here. Chronic proliferative pneumonia here. And here's enzootic pneumonia. And if you pick up the lung, it's a big, heavy, wet lung. A big, heavy, wet lung. That is secondary proliferative pneumonia, secondary to pneumonia here. Here's another case. This is chronic enzootic pneumonia. 21 days before, you treat it, and then you pick up the lung, and you strain yourself picking this lung, because it's heavy. Not that heavy, but it's heavy. It looks like it's meaty. It feels meaty and firm. Fabulous disease. Here's another case, chronic enzootic pneumonia. You have to feel it, and then this is a meaty lung. The catch in this one is we have no way of explaining it. How do you get that? How do you get it? 21 days. Sometimes it's 26 and 19 days or something, but Fox says 21. But, we get outside cases that are a little bit long and stuff like that. You treat them with the same way with atropine. They'll kick at the belly for 4 or 5 days. They'll be photophobic. They'll charge you out of the pen because of the atropine treatment, but they'll live. So that's secondary proliferative pneumonia. And we don't explain it. Now we're going to go to an even more difficult one. Look at this lung. This is called unilateral secondary proliferative pneumonia. It only occurs in a few percent of those cases that have secondary pneumonia, secondary proliferation, but it's only on one side. We can't explain the two sides, but it's so common you won't miss it. You know, if I'm around to say, did you palpate those lungs? And this lung is normal, and this is big and relatively firm and heavy and wet. Secondary proliferative pneumonia. Treat it the same way. It's a diffuse change throughout the entire lung. And diffuse change throughout the entire lung. One little picture doesn't show it to you. But we don't explain it, we recognize it, and we let it go at that. Now we have another lung. This is a Jersey lung. Jersey or Guernsey. All of a sudden the cows are all down in milk production, and they're all breathing hard. And they cough quite a bit. And you look at the lung on the slaughterhouse blacktop near the slaughterhouse, because the inspector didn't want me to take it away. And this is what you see, little green nodules throughout the entire lung. And when you see those little green nodules, and you cut them across, they have larvae in them. And these are lungworm larvae that were killed by the farmer when he fogged them. He had this fogger that has insecticide in it, organic phosphate or something like that, a little bit. They inhale it, it kills the larvae down deep, and then they respond with a granulomatous response to the larvae. And it's post-fogging pneumonitis, a nice entity, easily recognized. Now we have another one. You all know about farmer's lung. Now farmer's lung is because the farmer's coughing and hacking a little bit, and when he coughs and hacks, he goes, has his chest x-ray, and oh look, it's TB. But they keep working, he's not TB, and they leave him in the hospital a bit, he gets better. And they said, well, it's not TB, but look at those little spots. Farmer's lung, polymicrosporon fainii infection is what they finally will prove it if they biopsy him or something. And it's from moldy feed. Well, this is moldy silage from a whole crop of cows, and this is what the lung looks like. Again, usually Jerseys and Guernseys. I don't know why Jerseys and Guernseys, because if they have 75 cows in the barn and 5 of them are Jerseys and Guernseys, they've got it, and the Holsteins don't. But usually it's Jerseys and Guernseys. And that's what the lung looks like. Keep working at it, and maybe you can find a little spot there and a little spot there. All these little tiny spots, this is what you're looking for. The granulomas with pieces of the mold or spores, the hyphae, whatever, of polymicrosporon fainii, or is it micropolysporin? I don't know which one. Which one did I say? Micropolysporon fainii. And that's the pieces of mold that you see in here. A nice entity. Now, you got to keep those kind of straight in your heads, because now it's going to get a little more complicated. When you go to the bottom of the silo and smell that brown gas, as I did as a stupid little kid, there was fuming nitric acid on the chemical shelf in your chemistry lab. I took and smelled it. God, I thought I burned my butt. It was so bad. And I coughed and hacked for the rest of the afternoon at school. I only took one whiff, but what if I smelled too much as I was climbing up the silo of that brown gas? A woman in Chicago wrote this up years ago, Lowry, L-O-W-R-Y. And she wrote it up and she calls it silo filler's disease. And silo filler's disease is smelling the brown gas at the bottom of the silo. And if you don't get the proper treatment, which is corticosteroids, for the next 35 days, you're probably going to die with bronchiolitis obliterans fibrosa. The lung is going to be inflated, and every cotton-picking little bronchi is going to be a little shiny thing in the lung. It's going to be diffuse change throughout the lung. And what you're looking for histologically is this, is that little polyp of connective tissue that went through a damaged bronchus because of the higher oxides of nitrogen, but it is throughout the entire lung. That is very necessary for you to recognize that. If it's around a single abscess, you can have this lesion. You can have it around a worm, you can have it around anything. But it must be that this lesion is diffuse throughout the lung. And it'll kill you in day 35, 38, or something like that. And you can see the reason to treat this with corticosteroids, because you must stop that connective tissue. It has nothing to do with alveolar lining cell proliferation. And that is, well, I just told you, okay? Bronchiolitis obliterans. Now this one fools everybody. When you're a calf and you get cranial ventral bronchopneumonia, how do you get rid of that stuff? Dr. Fox, I love to use him because most people outside or around Cornell at least know him. He's a clinician. He's coughed and hacked most of his life because he chews snuff, used to smoke cigars and all that stuff, I guess. But anyhow, he got, what did he get? Cranial ventral pneumonia because of smoke, bronchiectasis. Purulent bronchiectasis, and he had a hard time, and every morning he would cough and hack for a half hour to spit up all that crap that those glands during the night, thinking he was getting cigarette smoke, they produced. Well, it made too much mucus, and he has to get rid of it in the morning. Finally, he had to go take a lung out, or both sides, or something. Because of his bronchiectasis, well, that's what happens in these lungs. If you look in these lungs, he's going to have chronic AV pneumonia. Chronic enzootic pneumonia of calves. But when you have that, you keep it for months, maybe a couple years. But what happens if you're coughing some of that goo-goo up from the cranial ventral lobes and somebody gooses you at about that time, if you're a cow? You suck it down the other lobes, and this is what happens. You get secondary inhalation pneumonia, and it's not uncommon. And especially if the cow dies with it, then that's when I'll get to see it. Oh, well, she was okay, and then she started coughing like heck. That's because she might have been laying down and something became loose and she sucked it. And this will do it. And otherwise, you're going to get all confused as to what that is if you don't recognize that disease. And a lot of people don't. Chronic enzootic, see the chronic bronchiectasis here, a little chronic. And you know, that's been there for, if this cow's 4 years old, that can be 4 years old, bronchiectasis. And you cough that crap up and you get it here and you suck it back down. There's a little fibrin plug here. You suck it back down, you get this secondary inhalation. A nice entity. Here's another one, same thing. Look at all this bronchiectasis. You suck it up and you get it secondary inhalation pneumonia. Okay. When we see this is almost pathognomonic for this new entity that you guys all know about as Neospora abortion. It's very common abortion up in our neck of the woods. It was not there years ago because we still have the slides, we have everything, and I photographed everything that's come in for the last 36 years, something like that. Anyhow, what you're looking for, you've got a nutmeg liver and you don't know why in a young calf. You look at the heart, there's no good lesion in the heart of anomaly that would make for a nutmeg liver. And then you say, well, what the heck would do that? You section this, and many times you'll find a multifocal myocarditis or scarring, and then you do all the FA and all that stuff, and it's positive for Neospora caninum. So it's Neospora abortion. It's a nice lesion. And here you see this heart's going to have the same thing. You might not see a good gross lesion. You must section it. And what else do you have to section? You must section the brain, because every case, we won't make a diagnosis of positive of Neospora unless we find FA positive heart or myocarditis encephalitis, because everyone have it, or almost everyone has it, if you can prove it. And you got to work hard to see the organism. I'm not even sure I do here, but he's got myocarditis. That's what you're looking for. Oops. You all know about nutmeg livers and nutmegs. Here's a nutmeg liver, a nice nutmeg liver. You worry about the heart thing. Here's the nutmegs and here's the nutmeg livers. That's all old hat for you. Don't forget now, here's a liver. It's got nutmeg all around the edge, like I've been telling you. You can have it away from the major channels that drain easier than the ones here. This is a big monstrous abscess in this cow's heart at the entrance kind of into the heart through the pericardium. And there's no fluid can go that way. No fluid can go forward. But he doesn't have great big blood vessels, and he might not have ascites or anything. So it's very difficult to explain for me in many of my cases, or our cases, how can they have such a monstrous stoppage of blood flow through that liver and not have nutmeg livers? You can see it. So it's just an interesting gee whiz lesion, but I think we should study it more, but I'm not going to do it. You all know about polycystic kidneys in the cow. It's not a big deal, polycystic kidneys. And most of them, when you see them, are in the cortex. Very common, polycystic kidneys. Here's an aborted calf with one kidney. Here's the other kidney. And all those cysts that you're going to see up closer are in the medulla. So you can have, shucks. Oops, I guess I lost that one. But anyhow, this is a polycystic kidney, but the cortex is essentially normal. And there aren't cysts in the cortex. So this is medullary polycystic kidney. They are different, so just think about it. A nice lesion in calves. You all know about the hematomas on the valves. That's just a little malformation of no significance. But what are you looking at here? Look at this is mostly blue. This is mostly white. These are big vessels. These are thin vessels. This is always in the right atrium of cows, and it's a we called it a hamartoma. Some people are now calling it a vascular shunt. I guess it is. It's a malformation in both cases, but this is a vascular shunt, mostly arterioles, mostly venules. So it's just AV shunt. Here's a little tiny one in the right atrium. They're very common, but not many people have ever seen the darn things. Here's a hematocyst, another hematocyst, another. They don't usually hurt. Sure, the hematocysts, they go away, dry up, and forget them. But every now and then when they get this big, when they get that big, they can interfere with the functioning of that valve and hurt the calf. That doesn't happen that often, but just know that it should, because the hematocysts can be monstrous. Now what causes blackleg? We talked about that the other day, I guess. What causes blackleg? Clostridium shovii. But why? And then some people say, well, there's spores in the muscles. And if you damage the muscle by an infarct or some jazz like that, you will stimulate anoxia, ischemia, whatever, and you will stimulate the spores to propagate. Then you get blackleg. I accept that for some, but how are you going to explain it when it's only in the myocardium? See the little fibrin on the surface here and there? A little fibrin just on the aortic outflow portion of the left heart, and that's blackleg in here. Now, you don't get infarcts there commonly, so how do you account for it? I don't. How do you account for it in the curve of the diaphragm? I don't. I just don't accept it in the way that everybody tries to tell me. So you all think of it your way too, I don't mind. The most septic, every time you see this, the most septic, black, foul-smelling vegetative endocarditis is in almost any animal, horses, cows, or pigs. You can bet there's probably an open joint septic arthritis. And that's what this was. He's got an open joint. But I'm just showing you the dark, heavily pigmented septic vegetative endocarditis. It doesn't show you much except he's had an open joint with arthritis. Just When you see this, mineralization only here, there's nothing wrong here. Nice mineralization in the endocardium. There's three things you should think of. Uremia, one, but that should also make the lesion up here. Two, you should think of the hypercalcemia of malignancy. And that's what this is, or it could be high vitamin D, low vitamin A. If some of you might be old enough to know X disease in cattle, chorionic naphthalene, a common lesion in them was a mineralized aorta that you could play golf with. And what is the clinical manifestation you measure to see if it has X disease? It was always vitamin A levels, and it was down here. So you should know that. Here's mineralization. This is uremia. Uremia. He's got mineralization here and uremia with mineralization. Upstate New York, they just put in they drilled gas wells, and they left a piece of wire cable laying around. And here's a wire cable, that's a Cadillac hood, and there's wire cable scratching the heck out of it. They left it around, and the green chopper went through it and cut it. But it made so much noise, the hired hand shut it off, because he knew there couldn't be that much wire around. So he knew it was busted. Why it was, because they were chopping this off. And you know, with the wire cable, those wires are not uniform. They're all different. And I was wondering about that. But the cable wouldn't work as a cable if they were solid strands, because you couldn't tie them together. It wouldn't bend. And I didn't know that either. So I learned a lot on that farm. He lost 29 cows because the guy shut off the metal detector in the front of this green chopper. Just hardware. Almost any time when you have hardware, what does it look like in a cow? And what's the size? It's always about this big, and it's got a crook in it like this. 4 to 6 inches with a crook halfway up. Why? That's something nobody understands until I think, if you want to believe me. You have an endless belt feeding the ensilage cutter. And that belt's moving along, and you have these blades coming along like this. And as this stuff moves about that far, this hits it, bends it down, and it breaks. And then it keeps going, because it keeps going, breaks it. And before it breaks, it bends that much, and then it breaks. That's why most of them are about this long, and they got a bend in it like that. And I've got a book collections of 300 or 400 of them to prove it. Now, some of them are absolutely straight nails, but for the most part, I'll bet you 85 are about that long, and they got a crook in it. So just kind of remember that. Now, that's the ones that cause damage, not the ones that are in the rumen, because they can eat nails of any size, but the ones that kill the cows. And here's another farm, and these are all, most of these are bred heifers. They're keeping them around. They're, 21 months or something like that, or some age. And here's one, and here's its shoulder blown up. And it's monstrous gas gangrene, blackleg. But the catch is, why? So I took a bunch of the kids out. We took a picture of this, and of the cows, because we posted 3 or 4 of them, because 9 of them died. And you go to the barn, and what are you looking for? You're looking for something sticking out and hurting them in the shoulder. One of the clinicians in the class said, in a seminar where it was presented, he says, well, we'd stop that by vaccinating them. What are you going to stop? Maybe the death from blackleg, but not the trauma to the shoulder. Because there's the iron rod that stuck out and whacked them. And it's just about shoulder high. So that's what you look for. I mean, you can vaccinate them, sure. This is a new entity for you and for us too. And what are you looking at? Well, you're looking at a blood vessel, and it bled out. Let me show you some more. Here's another vessel that bled out. These are all in the cow's abdomen. They bleed out with massive hemorrhage of the abdomen. But every time you see that, Don't look for a uterine vessel necessarily. What you do is you look for a vessel within 18 to 24 inches of the aorta in one of those muscular branches. Don't look down the uterus, even though she just calved. Because then if you do, I mean, you might find it, but you'll usually find it in every case, or almost every case, within this far from the aorta. Okay, it ruptured and she just calved, and you will say, well, something pulled on it too hard and it broke the baloney. That's not the reason. The reason is that Agway or some other jerko didn't know what he was doing, took the copper out of the diet, or interfered with the copper in the diet by too much sulfur in the water, too much iron in the water, or too much nitrates in the water without taking some of it out or giving him a little more copper. The problem there is you can't let the sheep look at any of that cow feed because they're going to die with copper poisoning. But these are the vessels, and this thing ruptured right here. All these vessels had ruptured right there. I don't want to show you too many, you get bored, because we got dozens and dozens and dozens of these, and they're always up on the east side of Cayuga Lake, about 30 miles north of Ithaca. And we have a few others, but look at the damaged vessel here, how it stretched, and how this stretched, and then this blew out. The good thing about it is you must cut, if this is a ruminal artery, you must cut another ruminal artery that didn't rupture, and you'll see the same lesion in it. Or if it's a uterine vessel, you must cut another branch of the uterine vessel, or something like that, or ovarian. Well, we don't do many bulls. We just don't see that many. But another equal size muscular artery, and you'll see the degeneration in there, because it's not due to acute trauma the first time. It's due to prior damage. And we got a big aneurysm here in one of them. I guess that's a good aneurysm. And it finally blew out. And here's a few more. Look at this. Here's a vessel coming down here. And all of a sudden it widens out to this thing here. And then it gets small again here, because there's the aneurysm. And they'll get aneurysmal dilatations, which says he had prior damage. And now this time it ruptured and killed the cow. This same thing here, the continuations down here someplace, it ruptured. See how big it gets, and they rupture. And it's almost just more of the same. Oops. Shh. There's a normal vessel, there's a normal vessel, and this is the aneurysm. It ruptured in a few places. You can't let the students cut these open either, because you'll get everything ruptured then. I need a diagnosis here. Very common characteristic disease in cows, dilated lymphatic. You can bet it's Yonis. Absolutely. And this is beautiful Yonis. And increased vascularity, even though it's mostly lymphatic, this is Yonis. And that's all you see in some of these cows. New York State has most animals die from poor husbandry. I have to admit that. And it's like this. What do you think this is? I showed you yesterday the core temperature gangrene affecting legs and foals and other species. But what is this? Look at the massive hemorrhage, massive hemorrhage, massive hemorrhage over the joints. You should say maybe it's nitrofurazone. But usually nitrofurazone's inside, and it's not just limited to the legs. When it is in the legs, that's frostbite. That's about the only thing that'll do it, to my knowledge, is frostbite. And most of the time, if the calf is licked off and is dry, I don't care how cold it gets, they won't die with frostbite. But if they're wet, they die with frostbite. You like polio? Now, polio is no big deal. You all know about polioencephalomalacia, thiamine encephalopathy, whatever name you want. You all know that. But what you should be aware of, and why I'm showing this is a wicked case. But what if you section that piece right there? You would not see the laminar necrosis. You would not see the neovascular proliferation. So you must take it from the areas that show the fluorescence. don't take a section for polio examination that doesn't have it. You might find it if you're lucky. But we always put everything that drops dead up there or dies, and we don't know what grossly. But the good thing about it is you can put these brains in formaldehyde and it doesn't hurt the fluorescence. They still fluoresce. So it's a nice way to do it. And this is fluorescence. This is too. These are, there's one live cow here, but all the rest are dead and donuts. And it's a nice entity. Electricity. There are no gross diagnostic lesions in electricity. I've looked at many of them. There's 9 dead cows here, and there are no gross lesions. She's from Israel, she's from France, he's from Spain, Italy. And this is a little box that did it. The guy, he goes outside, he's on the tractor, he turns that machine on to get the manure to come out so he can go haul it away. And all the cows start jumping. And when they once went down, they stayed down because they went into fibrillation. That was it. But it was just this little wire that did it going into the box. And the mice had chewed the insulation off. I think I got a picture of it, but I don't know. Oh, here's another one. Remember I talked to you earlier about diaphragmatic hemorrhage being pathognomonic for bleed out? Well, this guy's got lots of hemorrhages all over the diaphragm. These are kind of hidden, but these are pretty good where we've reflected the serosa. But this is one of the cows with the big bleed out. Very diagnostic. As in the other species I've already been telling you about, unilateral shutdown with atrophy. Here's a cow with unilateral shutdown and atrophy. She has hydronephrosis affecting both kidneys, but one kidney shuts down and shrinks and atrophies, and the other one stays the same size. If it's a young calf, the kidney might become bigger. You know, the kidneys start like this, and if you get unilateral shutdown, it shuts down, then it atrophies in the adult. If it's a young calf, it might get a little bit bigger, but don't worry about that too much. Unilateral shutdown with atrophy is what you're looking at here, because of insult to the same both kidneys at the same time to the same extent. Now, can you imagine the scene in Australia with my wife washing this ram's penis off out of the guy's hat of water? Because look at this ram. This is one of about 8 rams in 350 Dorset ewes, and it's a merino ram. It's going to be interesting because he has a hole here and a hole here through the end of his penis. Big deal. Don't go away mad, go to another ram, and he's got a hole here and a hole here through the end of his penis. And this is out in the boondocks in Australia. And well, I'll just keep showing you. Here's another hole, one here and one here. Just 2 holes in each of them. And these guys, and I did 6 of them. And 1, 2, 3, 4, 5, 6, 7, 8. 8 of them, I guess, yeah. Here's a normal. But they've all got 2 holes in the end of the penis. And the guy took out he had to because they're all affected. And I posted them. And that was on my way to Saudi Arabia. Man, that was a quick 3 days work. And we had to wash him off, and I took photographs of the gross and all that, but just show you a couple. But he took all the rams, the merinos out, and he put in some Border Leicester or some other lambs in there, or rams in there, with those 350 whatever ewes. None of them got the disease. But he had to get all those sheep bred, otherwise you'd lose a whole year's crop. So he bought another 5 or 6 or something like that, merinos, and put them in there, and they all got the same thing also. To this day, we don't know what did it. You can imagine anything you want to, that somebody, here's one dog, he's only got 3 legs. But anyhow, this is the hills of Australia, and these dogs are corralling these sheep. And they did the job well. They did the job well. But why would they get a hole in the end of the penis? We don't know. You can imagine dogs going in there, but heck, if the sheep are being bred and the rams are getting excited, they'll stop everything, they'll go inside. Their prepuce wasn't hurt. We thought, well, maybe one of those pregnant females was blatantly pregnant. Not really, but she had a macerated fetus in there, and one of the fibulae of one of the macerated fetuses was just in the birth canal, so that with the insertion of the penis, boom, he gets 2 holes in it. That's a possibility, but we never found that sheep, and every dang one of them was inspected. We don't know what did it. Somebody says somebody's out there practicing, but that means the ram's got to jump off the female, and just at that time, if the end of the penis exposed, somebody shoots it with a .22. But that's out in the boondocks, and everybody hear guns going off. And they don't have many guns in Australia anyhow. I mean, like we do, I guess. So we don't know what did it. But it has been reported before, and they didn't know what did it. It is not pizzle rot. It is not, there's lots of diseases, infections they get, but those lesions were not infected. I mean, primarily infected. So you got a nice thing to guess about. Look at what's wrong here. They've lost all their tail, their tongues, the tip of their tongues. And that's ergot poisoning. And they all got a hole of some moldy feed with ergot in it, and so that they just rotted off the tips of their tongues with photosensitization too. This is ORF, contagious ecthyma. If you haven't seen sheep with contagious ecthyma, monstrous infections with this virus. And here it is, contagious ecthyma on the tongue of sheep. It's a wicked disease. But don't forget, contagious ecthyma virus is very winter resistant, and you can get it on your fingers or any other parts of you. If you're a gentleman, you're not going to urinate behind a tree without washing your hands. Otherwise, you're going to get lesions like this, and it's going to hurt. They do hurt. Mm-hmm. I didn't get one. Anyhow, here's a nice squamous cell in the mouth of a sheep, just to show you that sheep get it. Here's a squamous cell on his nose. Big discussion about that. This is all eaten out with squamous cell carcinoma on his nose. Here's his lower teeth, of course. He doesn't have any uppers up here. All squamous cell, just eating them out, just like it does in humans or anything else. You have horn tumors, or you have squamous cells in the ears too. And they're in the sun all the time. Now this is one from Ithaca, but darned if it isn't a squamous cell in the side of the neck. It looks bloody, but that's just black tar or something to keep the flies off it. You can get infections in the nose, actinomycosis or actinobacillosis, just to show you a few little oddballs in the sheep. This is a little horn tumor growing in the end of an ear. Here's his eyes and the guy's fingers, but he's getting a little tumor growing here. Here's a big tumor growing above his eye. They get everything you can imagine if you don't play with sheep. They get them. Now, what's the matter with these sheep? They should be white. That's probably a white one there. But why are these black? Because they had a brush fire, and it burned the living heck out of all of them. And many of them will die 2 weeks later, a few days later, if they're really stupid and don't run right through the fire. But they're all burned. That's why they're all black. They should be white. Here's a white one that's, partially. We're continuing with the sheep from brush fires. They are really wicked, and this guy will live about 3 weeks because he's not burned that bad. I don't know the good ways of telling which sheep are going to live and which sheep are going to die. But we got there just at the end of a big brush fire, and we get to see a lot. What do you think this little goat has? Of course, he has bottle jaw. And he's got Haemonchus contortus. The catch in it is, if you autopsy this guy, he's going to be very pale. That's not him, but he's going to be very pale, no blood. And many times, The worms are smarter than we are. They will leave the sinking ship. And you won't find any worms in the abomasum where they should be. And therefore you'll say, well, gee, he doesn't have hemoncosis. But if you've got 50 sheep in the flock, you'll find a few, so just cut the throats of a couple others and you'll find them. But just finding the hemoncus, the parasite in the stomach, doesn't mean he has the disease hemoncosis. He has to be anemic to have the disease. And some of them just have the worms. Another thing you should know as a diagnostic pathologist, that many of these sheep, the big healthy sheep, are the pigs of the pen, so to speak, and they might suck up the last of the water. And if you have a tank of water or a pond of water or some container of water that the sheep have defecated in, all the worms have hatched, or many of them, or all of them, whatever, and you'll have lots of hemoncus in the water, larvae. Well, they don't like to spend all their time floating at the top, so they'll be down at the bottom. So when you gulp the first gallon from the top, you'll get 10 worms. You gulp the next ones, going halfway down, you get 50 worms a mouthful. But when you get down to the bottom, you might get 2,000 worms a mouthful. And it's the last guy who drinks the dregs in the bottom who might get the most. So you always have that problem of why don't all the sheep have the same number of worms? That's the reason. This is a fantastic lesion in all species. This happens to be an abscess around the pharynx in a sheep or a goat, I've forgotten which. But you and I, if we're tossed on our face on a pillow or a sheet or blanket as a baby, we're not going to suffocate because we will contort our mouths so that we can get air in there. And you know, babies don't die with their face down. Well, some people argue, but most of the time they don't. And pigs and calves and these sheep, when they have a mass in their throat, they can be awake or they can be asleep, but not anesthetized, and live with this mass. But as soon as they're anesthetized, for somebody to put a tracheal tube to take that out, if they're not ready to get the right size after anesthesia is given, these animals will suffocate, as this one did. And we had two in the same day, and they both suffocated because they didn't believe us the first time. And the second one died. So don't ever get anesthetized by incompetence, incompetent people, if you got a lump in your throat, because it'll suffocate you. That ordinarily, if you're awake, it wouldn't. This is just tell you the size of parasites. Hemoncus, Trichostrongylus here, Nematoderus or Couperia, and Ostatagia. You know, they're little worms, just to keep you honest. Now, we do have acute ostatagiosis in sheep. This is the middle stomach worm. Hemoncus is the largest one, Ostatagia is the middle one. And this is acute ostatagiosis causing a edematous, hemorrhagic, slightly necrotic abomasitis, and it'll kill you if you're a sheep. This is when it's chronic, and when the worms have been killed or they've left for whatever reason, you've wormed them or something, you can leave clumps of white blood cells behind as little nodules, and they call this the Morocco leather abomasum. Sometimes they're not that prominent. You just have a little bumpy abomasal mucosa. Fabulous lesion, actually. Here it is again, chronic ostatagiosis. Now, you cannot tell these apart necessarily, in some cases, from coccidia. Nina Cole Yakimovy or Imeria Nina Cole Yakimovy and several other coccidia will make lumps in the abomasum that you can't always tell apart. And here they are. This is a Nina Cole Yakimovy, and there's several others. These are the coccidial parasites, not nematodes, not the worms. And here's the end result of more parasites in the abomasum in the sheep. This is the esophageal groove here someplace. Well, I actually don't see it well. But this is near the esophageal groove because these are the unguiculate papillae. Sometimes these can get exceptionally long and interfere with swallowing deglutition that the ruminants need. Many times sometimes they become neoplastic, true neoplasms in this region. But they're normal. Those things are normal. Now what you're looking at is, you're looking at this piece of gut, essentially normal down here, filled with fluid, and this piece of bowel getting big and thick with all these lumps on it. This is an adenocarcinoma of the small intestine in sheep. It is seen in lots of locations all over the world, and nobody really knows the cause. But there is a fellow named Tony, I forgot his name right now, in New Zealand, who believes it, and he thinks he has reproduced it, that it's caused by some insecticides or herbicides over there, and where you treat the grass or something for weeds. But I'm not sure that's been proven yet, and other people agree. But anyhow, carcinomas in the intestine that block the bowel. And here it is again on cross-section, and you don't see the tumor per se as a lump. Maybe there's something in here, but you don't see it well because adenocarcinomas in intestines do that. They don't make nice lumps. Here you're looking at the same thing again. The gut's compromised over here, and it's all tumor masses all over the place. Now here's normal bowel over here, and here's a tumor here. You can barely see it, but you can see that the intestine is now getting much bigger. And this is called the napkin ring effect. Some people call it's an annular constriction because the tumor is growing right through here, all around that thing like that. And it's a napkin ring effect, adenocarcinoma. And when your grandmother goes in for surgery, or I go in for surgery in a few years or a few months because I got a blocked bowel, this is probably what I have. They'll cut out a big piece here and a big piece here and sew them together if they can. Here it is again. Now these are a little different because they're growing down in and making polyps here. But that's adenocarcinoma in sheep intestine. This is a characteristic lesion of enterotoxemia. That's not too important to me. It's a common disease. Splotchy hemorrhages says enterotoxemia. But the cute thing of enterotoxemia is, look at this piece of intestine. The greenish part is essentially normal. All the rest of that is massive lymphoid hyperplasia. Not tumor, hyperplasia. And it's very, very diagnostic if you see it in a suddenly dead sheep for enterotoxemia. To me, it's pathognomonic. Nothing else does it. But, you know, I haven't seen everything. And these kidneys are just mush from the sugar generated by the infectious nature of this disease, as different from those others I showed you. These are pulpy kidneys. Look at the medulla. It's perfectly healthy, almost normal, but the rest of it is all mush, and that's pulpy kidney disease. Look at that sheep's kidney. That is pulpy kidney, just mush. Coccidiosis. It's in the intestinal coccidiosis. All these little white spots are all intestinal coccidia, clumps of them growing in the intestine. Surprisingly, these can be monstrous and not hurt the sheep. And look at how bad that intestine. These are all epithelial cells, the mucosal lining cells with the parasites in them. They have schizonts and megaschizonts and all the rest of these names. I forget them from seminar to seminar. Now look at this goat. That goat is a perfectly healthy goat. Look at all of those nubbins. They call this intestinal adenomatosis in Australia and New Zealand, I guess. But we see it. This is in this country. And this goat is perfectly normal. Why doesn't he have diarrhea out the gazoo? Because many of them do. Because he doesn't. But that's no answer. It just means I don't know the answer. And of course you have tapeworm cysts, and all these of course are nodular worms, granulomas of nodular worms, esophagosinum. They crawl in there and stimulate a lot of connective tissue and mineralization. We showed it to you in the cows just a minute ago. Look at these great big thick lymphatics, great big thick lymphatics. They're not blood vessels, those are lymphatics. That is Johne's disease in sheep. And that's a bacterial infection, and it's a pretty serious one. This is all Johne's disease. And you can see him running counter along the gut too. That's lymphatics, the little lymph vessels filled with infection and reaction to those parasites, to those bacteria. It's getting to be a wicked disease in our cattle. Well, this shows you, this is Johne's disease with the infection in here, thickening the bowel. And this is the normal bowel with just feces in there. And you make the diagnosis based on that too. And you can do the same thing here. This is Johne's gut, and this is the lymphatics with massive Johne's disease and the lymph nodes. Well, sheep don't want to be outdone by cows, so what you're looking at here is normal fat in the bone marrow, just like a cow, dog, or anything else. And this is red marrow that has been stimulated to start growing, because it really should be all fat in an adult sheep, unless they're anemic. So that says this guy's a little bit anemic. Then you're looking up here, that's spongy bone. And you have one more change here that's very diagnostic, and that's right here, this tissue here. It's not fat, it's not red marrow, sure as heck isn't bone. What's that white tissue? That's lymphosarcoma. That's a malignant tumor of the white blood cells, lymphoid cells, malignant lymphoma. And the sheep don't want to be outdone. Underneath this, you can see these are slightly swollen. That's lymphosarcoma. Lymphosarcoma, lymphosarcoma. Oops. I showed it to you in a horse, but this is in a sheep. You're looking at the cecum or colon. Well, this is the colon. Here's the ileum coming into the cecum right here. And look at the cecum. It's dark red, and then it's normal, and then it gets dark red, and then the colon gets normal again. This, and if you smell this smells like urine, because this is called uremic colitis. The colon has taken over the excretory function of the kidney, because the kidney's been wiped out. A lot of things can wipe out the kidney, but a lot of toxins do. But this guy's got a bad kidney from amyloidosis, and he got the amyloidosis because he has chronic bronchopneumonia. So the bronchopneumonia causes renal amyloidosis, the kidneys stopped functioning because they had it, and the colon took over its function, but it can't do an effective job on it because it's not a kidney, it's a colon. But it's the body's attempt to compensate. I made the mistake of cutting off a little too early in that last group, but now you're looking at a goat's neck in Switzerland. The reason I'm showing it to you is because he has beautiful traumatic lesions limited to the neck, some of which looks like they've been scratched. So, but if you look, here's his ear, look at his neck, and his trachea has been traumatized. And this, of course, is a nice entity caused by the lynx. And these got nice, the bite holes, the teeth marks you can see in his throat. And these are European lynx that are attacking the goats. They were trying to bring the lynx back, but the lynx like to eat the domestic goats. The reason to show it to you is because I was asked to work on the caribou in Newfoundland, and they were all killed. The calves would be killed early in life just by the lynx, the Canadian lynx, killing them by the same method of damage to the neck. So when I first worked on it, nobody told me anything about that. But this is a good case from Switzerland. Now we're going to change slides to the next box. It's very nice to be able to work all over the world, wherever you go. And if you go to Saudi Arabia or Israel, places like that, you'll see the goats with these lumps in their skin. Just like in the cow, hypoderma, and they're hanging on to the skin after you pull the skin off. Just hypoderma, just like in the cow. A very common lesion in sheep and goats, and we don't know the reason, are the multiple polyps in the very first part of the duodenum, because this is a pylorus and this is a duodenum. We don't know what causes them. Here's a bunch of them right here, multiple polyposis of the duodenum. The cause is unknown. Big discussion on this one here. You're looking at, it's a sheep, mane or goat, because of the white fat. All other animals don't have such white fat, and this is pretty good. Normal lung, forget the red congestion. It's not congested, it's just pooled blood after death. But what is this big mass here? Well, if it is mostly, it must be an older sheep, and therefore it's going to be a thymoma, and that's a tumor of the thymus. Other people argue, oh no, it's lymphosarcoma, and you don't want to call it a thymoma. Well, I don't know how you want to argue that. Many times when these are old sheep or old goats, these can be squamous cell carcinomas, or they might be lymphoid, pure lymphoid tissue. Well, that's an argument, and I don't know how to resolve it. Here's a fabulous lesion, very difficult to, very difficult, it means nothing to you and I as we look at it here, except this is green, and this is a pond, and this is, it had a fire, but that's not as important. This green stuff here that you're looking at, that is blue-green algae. And if you feed it to sheep, they'll end up with great big gallbladders, fatty livers, and dead because of blue-green algae poisoning. And I think it's now Microcystis toxica, but it could be polycystic toxica. I don't know the name right at the moment. I forgot. And here you're looking at the kidneys are normal, the liver is small, and the gallbladder is big because it's primarily a liver toxin. That's what you've just looked at. Hemangiosarcoma in sheep's livers. It's not any different than any other animal as far as I'm concerned, if you look at enough of them. Now, this is a sheep on our post-mortem room floor, and that's its rear end, and it has a very characteristic odor. It smells like garlic or onions, the feces. And when you see that, you better be thinking that it was given glycerol glycolate, or it might have been given one other chemical that will make this odor. And it is changed in the rumen to make that odor, because it doesn't smell like that when you give it to them. But it'll kill them. Very odd lesion. This is the mammary gland of a female goat, and these are two ectopic mammary glands in that female goat. They will shrink finally because there is no duct, there's no teat canal to use, and they will finally wither away, so to speak. But a lot of people don't know what they are. These are sheep that have hard udder disease, and the hard udder disease is really another name for CAE virus mastitis. When they have CAE virus, the mammary glands are very hard and bulging, and they can't get any milk out of them for the lambs. The lambs will actually go hungry. And here's what it is up close. Another one of those three with hard udder disease. There's nothing diagnostic about it. You'd think it'd be a normal sheep. But she doesn't let her milk down, or she doesn't have the milk. But you don't have good lesions, except you have good round cell foci around the blood vessels and scattered in the gland. That's what it looks like when you cut it through. There's not a good lesion there. This happens to be South Africa, and he's got this big mass around this ewes vulva, squamous cell carcinoma. Now, many of their animals, they call them fat-tailed sheep, and the fat-tailed sheep protect the sheep against this lesion because the sun, it's very sunny down there compared to the United States, and they will get sunshine-induced squamous cell carcinomas of the vulva, unless they have that big flappy tail. But when they have that big tail, they will get fly blown more easily than not. This is a uterus from a sheep, and you can see the normal melanosis of the caruncles of the endometrium. That's normal. Oh, you have to work at this pretty good. You got these great big clear cysts associated with this liver, and then in the liver you got a lot of, bloody tracts or blood areas of blood. You don't know what they are unless you take a picture of another area of liver, and this is the scolex area, or the head end of one of these cysticerci that are crawling through the liver. They might not be cysticerci, I think I've forgotten to tell the truth. But as they get closer to the surface, in my opinion, they will damage the liver neurogenically so that the liver gets a little bit fatty as the worm crawls through and leaving a bloody tract behind. And that's just intermediate tapeworm cyst migration in the liver. Whoops. Now look at these two lambs. Monstrous thyroid here, monstrous thyroid here. And you do the autopsy, you open them up, a big thyroid and a monster thyroid. I took these a number of years ago, but I don't know why they're so bright now, unless somebody traded them for me. Anyhow, these are goiters. If you look at this one, that is a cystic goiter. And if you look at this one, that is a cystic or colloid goiter, whereas this is an adenomatous goiter, or a hyperplastic goiter, where you have the epithelial cells are proliferating and not just making large cystic structures. The catch is they're on the same feed, and the mother is on the same feed. And in one instance, you get one kind of goiter, and the other instance here, you get another type of goiter. The problem with that is that I heard that, if they're on hypothyroid diets, they get one kind of goiter, or if they're on too much iodine, they get one kind. If they don't get enough iodine, they get the other kind. I don't believe that anymore, based on this big outbreak we had in around Ithaca, because you can get both kinds under the same conditions. So I don't know what to tell you. And if you're a little ugly lamb born like this with a big goiter, this is a lamb, and this is just like the cow. Here's a normal lung here, the normal lung and the heart down here, and this is a great big mass. This is a bronchial hamartoma in his chest. It's one of those things that aren't quite a tumor, although they call them fetal tumors. So that's just a monstrous mass growing in here. And he got a little bit of hemorrhage. He got a little bit of hemorrhage in here because being born, he probably ruptured a few blood vessels. He was just too big to be born naturally. If you look at this one, the only lung you can possibly see here is this little piece here. The rest of that is a bronchial hamartoma. And here it is when we've taken it out. Here's a lung on the other side, and this is the lung on the right side that you just saw. Here's his heart. So just common anomalies, malformations. Now this one you have to work at. This is the Republic of South Africa, and you look at his heart, it's normal size, but look at his lung, it's very tiny. What's wrong with him otherwise? And that's the question I'd ask my residents to say, what else is wrong with him? And they must say he has a malformed brain, because that's about one of the only things, to my knowledge, that will cause a small lung, hypoplastic lung. And that's what we have here, a hypoplastic lung. Well, this is a uterus in a sheep with lymphosarcoma, but it's not very specific. Lympho does anything it wants to. You all know what this is. You've probably been quizzed on it often enough. And it's a cloisonné kidney. Well, this is cloisonné jewelry that I got in Taiwan when I was over there playing around. And just to show, this is I believe it's Angora goat. I believe that's what it is that right? And an Angora goat with a cloisonné kidney. Now you know what cloisonné jewelry is anyhow. Now this is a big kidney and a little kidney. This is unilateral shutdown with atrophy of one kidney. But both of these kidneys have the same disease, and this is a form of Dubin-Johnson syndrome, a biochemical defect affecting hemoglobin metabolism. And as a result, the hemoglobin is not normal. It deposited in the kidney and in this kidney too. And they both have the same renal underlying lesion, but this went ahead and shut down and atrophied. So you can get unilateral shutdown as a result of damage to both kidneys at the same time. And that's what happened here. This is a neat kidney, but this is a Finn sheep, and they get an immune glomerulonephritis, the Finn sheeps. Finn sheeps are good because they often have twins and triplets. Oops. What you also see in here is a degree of hydronephrosis. Now, why do you get hydronephrosis? You get it mostly, even here, more Finn sheep, hydronephrosis. Why do they have hydronephrosis? Now these are lambs, and they have hydronephrosis for one good reason, and that is the urine tastes funny. If the urine tastes funny, the old lady is not going to lick it in order to stimulate defecation and urination. Because if out in Mother Nature, the best example is possums. You know, possums might have 6 or 8 babies in the pouch. And if they urinated and defecated ad lib, so to speak, they would be living in a septic tank. But the only time they defecate and urinate is when the old lady puts her head in and licks their genitalia with a warm, wet tongue. That stimulates them to urinate and generate and defecate, and she keeps them clean that way. Well, if the urine tastes funny for these sheep, this is how you can tell they've been orphaned sometimes. Normal lambs, is because the old lady doesn't want to taste that funny urine because she knows it's not normal. And these guys are dying from immune glomerulonephritis. More of the same thing. More of the same thing. This is a nice lesion. You're looking at a sheep's kidney, and what's this layered laminar abscess? You better be thinking of caseous lymphadenitis. Nothing special about that one. This is a goat, and when you look at a goat, what causes this papillary necrosis? Well, just like it does in all other animals. This animal was given banamine or butazolidine. The catch on it is, what are they doing giving a 6-week-old goat banamine and butazolidine for? Nobody knows. We asked the owner, well, we thought it was good, let's give it. But they've been giving it to it for 6 weeks. And they got they got papillary necrosis, renal papillary necrosis from Banamine butazolidine. And you have some here too, but that might not be Banamine, certainly could be, but it could be a degree of pyelonephritis. So it's not 100%, you can tell for sure. This is great. This is copper poisoning. And your nice fatty liver, dark urine, dark kidneys, icterus. And the spleen is in here just because it's a little bit mushy, a little enlarged. But that's not such a good lesion. But the rest of them are great. And they can get the most common cause of this disease in New York State is what? Horse feed. Because horses have an increased dietary requirement for copper. It is put in their diet by the feed companies, and it is extremely toxic, usually, to sheep and goats. Don't ever let a sheep look at horse feed. But, you know, if you got a horse and a sheep, you might do that. You like lymphosarcoma, or if you don't, you're looking at it here, multifocal lymphosarcoma in the kidney of a sheep. This is just polycystic kidneys in lambs. They all have it. I just want polycystic kidneys in the lambs. That's sunshine, because it's the only way to get it bright enough sometime. And that's sunshine pictures and polycystic kidneys. Another form of polycystic kidneys. They all don't read the book. I'm getting tired of talking on this. You're probably tired of me talking about it too. But anyhow, essentially normal kidney, pulpy kidney, really pulpy kidney with enterotoxemia. However, if this had been treated with sugar, could possibly have the same thing. Normal melanosis in the kidney of sheep, of no significance. But when you look at this one, you got some of the black stuff here. The rest of it is black. And it looks like there's an increased granularity of the cortex. Well, this is pyelonephritis. And this is pseudomelanosis caused by the bacterial action on blood releasing disulfide. And therefore you have pyelonephritis. And that's pseudomelanosis, not real melanosis. Pheochromocytoma in the adrenal of sheep. Nothing special. So I'm trying to think, but I'm showing it to you because it's not many people think of tumors in the sheep very often. Maybe they don't live that long, but there are some sheep that stick around. And there's a great big pheochromocytoma. And earlier I spoke about thyroid tumors commonly going into blood vessels. Well, here's one, adrenal pheochromocytoma growing into the vena cava. I like this one for a good reason. He's got a nice brain in the sheep, and he's got this lump where his pituitary should be, and that's an abscess. And they thought he had listeria. Well, he could have had listeria, but he's got a nice abscess in the brain, in the pituitary, and he had no signs referable to the pituitary. Again, we tell you, lymphosarcoma in all species does what it wants to do. And this is lymphosarcoma in the region of the pituitary. And I've plumb forgotten what that one was. I'm not even sure it's worthwhile telling you about. But I had it in there for a reason. Oh. Bear with me, folks. I'm very sorry. Oh, this is another pituitary lymphosarcoma, and it mimics almost every disease. Shucks. This is got a big purulent infection in the lung because he's got a liver abscess that ruptured, and you don't see that very often in sheep. I think I put this on because it's such an odd one, and somebody gave me an argument about it. But here's a sheep's liver. Here's a liver abscess. I'm holding it open with a needle to show you that it is a liver abscess that ruptured and ruined the lung.